TV presents in 3, 2, 1. Dateline Schools with your host, Terry Harrington.
All this week on Dateline Schools, we're learning some tips to give this school year off to a great, healthy start for our students. And to give us some tips, joining me today from the Clair County Health Department is Margaret Sturgis. And Margaret, yesterday you gave us a good description of some of the immunizations that our kids need to be up to date and to be protected. If a parent finds out that their child needs a booster or two, what do they need to do? Where do they need to go?
Well, this is the best time to be looking into that. They need to check with their healthcare provider to see if their child is due for anything or is coming due soon. They can also call the Clair County Health Department and we can check that for them. Or if their child is between 10 and 21 years of age, our Teen Health Center.
Okay, great. And do they make appointments via that Teen Health Center and at the Health Department?
Yes, the Health Department and Teen Health Center are by appointment only.
Okay, and we know the doctor's offices are too, right?
Yes.
Great. You know, in the last couple of years, we've heard a lot about whooping cough. Was it a year ago? We had a measles outbreak up in the Yale area. Are those concerns been pretty well addressed now?
Well, actually, we are still very concerned because vaccine-preventable diseases such as whooping cough or pertussis and measles continue to be a huge problem in the United States. Currently, there are 580 cases of measles in the U.S. as of right now due to multiple outbreaks and nearly 10,000 cases of pertussis or whooping cough. Locally in Clair County, we're seeing an increased number of cases of whooping cough or pertussis, but luckily, so far, no measles cases.
Great.
But we are concerned.
Now, also with the whooping cough, that becomes an adult issue too, and shouldn't we as adults get a booster as well?
Absolutely. Adults and do need to get a Tdap booster.
And I guess too, when we stop and think about it, the close proximity our kids have with their classmates and their teachers and that makes it real important for these immunizations.
Absolutely. That's called herd immunity, when we are able to protect our students because everybody around them is also protected.
Now, are these vaccinations free, or do most insurances cover it? How does that work?
Most insurances for children do cover immunizations. However, if a parent has insurance that does not cover immunizations or doesn't cover the full cost, we do participate in the Vaccines for Children program, and so do many doctors' offices, where those vaccines are free except for the administration cost. They just need to call the health department for more information.
Okay. And what's that health department number?
It is 810-987-5729.
Back with more tomorrow. For Dateline Schools, I'm Terry Harrington.